Welcome back to Morning Line on this Wednesday. Nick Beres along with Malpractice attorney Clint Kelly. It's good to have him on this morning. We've got some calls for him as well. And we're going to take a call next up from Linda. Linda, good morning. Hi, Linda.
Good morning. You know, it wouldn't be right if I did call in and ask the question.
Sure.
I had knee surgery. I have contacted the surgeon's office through messaging services and all, wanting just to know what was the name of the implant or the knee that they gave me, so I would know what the knee company was in case there's a recall. And also, I know that a lot of nerves have been cut and all. It's been going on 4 months, and the bottom of my foot on that surgery leg still continues to be numb. And it's just every time I say something, he says, "Oh, well, it can take over a year to get the feeling back." So should I start documenting and all that kind of stuff? I've been to ER because I thought I had a blood clot, and they were just like, "Oh, well, it's a nerve. Don't worry about it." So should I,
Okay.
It's been 4 months, and I just want to know what I should start documenting.
Thank you, Linda. All right. Yeah, that opens up a whole can of worms, and we talked about joint replacement and how they can be problematic cases. What would you tell her?
All right, first of all, Linda, document everything. From this point forward, document everything. Secondly, you need to get a second opinion from another doctor. They do it privately. It doesn't have to be something that's difficult. Most health insurance plans will cover a second opinion. You need, particularly with this numbness in your foot or difficulty you're having with this nerve issue, you need to get a second opinion, because I don't know that you're getting the straight story from your doctor, and it sounds like you don't trust him either. So that's when you need to get a second opinion. The third suggestion I would give you is go get your itemized bill. I don't know if it was an outpatient or hospital procedure, doesn't matter. You go and ask for the full itemized bill, not the regular bill they send out to the insurance company. It's like you get an EOB on. I mean the one that's down to the penny, because that will likely identify the hardware that's in your knee. Because when they charge for it, Nick, they will usually list the manufacturer of that hardware next to the price.
Okay.
So that's how you can identify the hardware. If that doesn't work, the hospital has to tell you. So, because technically you paid for it. So if you can't get that information directly from your surgeon, you go to the hospital and get it if the bill doesn't show it. But there's certainly a way to find that out so that you can be vigilant on that particular hardware.
Have you ever seen video of a joint replacement surgery?
I have.
Okay. It's pretty rugged stuff, and they go in and cut a lot, and nerves are cut, and oftentimes doctors will say, yes, there are nerves, you may have some numbness that should restore. Is that what makes this problematic? Standard of care means, yeah, we cut some nerves. You're probably going to have some numbness for a while. It takes nerves a while to grow. Is that what makes these cases hard to pursue, or what would, in her case, be something that would get your interest?
If she has lost some function in her foot, I don't expect that to happen from a proper knee replacement. Okay. I would expect there to be full function in her foot. If there's some numbness, but she has function in her foot, probably let it go. But if there's going to be some motor dysfunction, I'd want to know, and I'll tell you, everybody this, when a doctor says, and you laughed about it because you knew it when you heard it, when a doctor says, let's give it a year and see how it's going to work, no way.
Yeah, because they're pushing you to that statute of limitations. She says it's been 4 months for her.
Okay, that's when you've got to go get a second opinion.
Okay, so she gets the second opinion. If she does, and they're telling her, yeah, there's a problem here, she should call your office. Absolutely.
Absolutely. Okay. I mean, but in this situation, what I would do first, though, is find out who the manufacturer is of the hardware. You can do that through the hospital, get that bill, and then go get your second opinion and see where you are. Your second opinion guy may say, look, there is going to be some recovery time. I do expect there to be recovery. But he might also say, we got a problem here.
Yeah.
And in that case, obviously, you're going to want to transfer your care to somebody else. I just don't like any doctor that says what they said to Linda.
Yep, we're both red flags there.
Yep.
You know, and that's a common surgery that thousands of people have every year in this country.
It sounds like he's blowing her off.
Yeah, right. And you picked up on it too. I was thinking the way she was talking, she's not sure she trusts him.
Yeah.
Other common things. I don't mind sharing this, but a couple of weeks ago, and I quizzed Clint about it beforehand, I had to go to get a colonoscopy, and I was quizzing him on this. Now, with regard, I had asked, so Clint, what kind of things can go wrong with a colonoscopy? And, I quizzed, and everything, by the way, went fine. Not real pleasant, but hey, go get one at some point if you get to that age. You told me it's rare, right, that there's malpractice cases with colonoscopies. It's maybe if they puncture the intestine?
Yeah, there's about a 1 to 2% rate of perforation, where it can be a through and through, which is directly through the wall and into the colon. Sometimes they can be nicked. The danger there is obviously there's feculent or there's fecal material that could leak out. And get into your system and cause an infection, which leads to peritonitis or sepsis, which can be deadly if it's not detected. So, I mean, these things happen. If they're detected in an appropriate manner and dealt with, everybody should be fine. Where I come in are the cases where the perforations occur. They're not detected as they should be, and there's significant damage as a result. Like, say, for example, somebody gets blood poisoning and dies from it, or they have to have large sections of their colon removed because the colon died. That's another thing. When there's a perforation in the colon, it's like a gunshot wound.
Blood flow, and just
blood, but that because the colon's an organ. Right. If that organ starts to lose blood and gets infected, then the surrounding parts of the colon begin to die. And the scary thing is if you don't get to it quick enough, if enough of the colon dies, you die with it.
Can there be a case if they go through there, do it, everything's successful, they look and they say clean bill of health and they missed a tumor?
A tumor?
Or they missed evidence, clear evidence of cancer, and they just missed it. And then, 6 months later, you're like really feeling pain. They go in and say, wow, and it was there. Now, I guess you're going to have to prove it didn't develop within that 6 months. But I'm just saying if they misdiagnose, they go in and look and miss.
How do you miss it with the scope?
Yeah, I don't know.
I mean, I'm talking about if it's there to be seen. I'm not talking about something that's precancerous, that's difficult to find, that may have a little room.
Yeah, it's going in there. You're looking at it. You're going to see it. So maybe that's just doesn't happen.
When you say tumor, that
there's no way they'd miss that.
That's negligence if you miss it.
If they miss, So in that case, if that happened, I would imagine it doesn't very often. You'd say, look, it's pretty obvious this has been there more than 6 months, and how could you have missed this when you did a colonoscopy? You could have a case in that regard.
And the reason why there would be negligence in perforating the wall of the colon is if you are doing the procedure and you suspect that might have happened, your job is to do what's called running the colon. You have to go in there and inspect the walls of the colon to ensure there's no evidence of perforations. They can see it, but they have to look. And if you perforate, there's going to be bleeding. It's just tissue. It's like anything else. If you put the scope through there and you tear it, there's going to be blood vessels that are torn with it, and it's going to bleed. So again, you got to find the perforation to fix it. But if you don't fix it,
now, in a case like that, since it's so common, do you still need the doctor to tell you what the risks are? Because you always say, you want to ask questions. They didn't sit down and say, at no point did a doctor tell me, Nick, we could perforate your colon. They didn't tell me that when I went in. Are they supposed to?
Yeah, I'm surprised they did. Now, I imagine if you look at your surgical consent, that's got to be somewhere.
Okay, it may have been on what I signed. It very well could be. I just don't remember having a conversation along those lines. I knew about it because you and I had talked. But, again, just to remind everyone on this, they need to give you knowledge ahead of time, and some procedures are more risky than others. So we're going to do this, and I'm going to tell you right now, it's 50-50 that this is going to happen. And you can decide, is it worth the risk or not?
Yeah, absolutely. I mean, that's part of the healthcare providers are very well paid, and they're very well paid for a reason. They have a number of duties they have to follow, and one of those duties that they owe to patients is to get informed consent. They are to give you all the information necessary about the procedure so that you can make an informed choice. You control your body. You've got the ability to say yes or no. But in order to do that, you have to make an intelligent decision, and the only way you can make an intelligent decision is when the physician gives you proper information about risks, benefits, and alternatives to the procedure. Now, once you get all that information, then you can make the decision. When they don't give you that information and you make a decision, well, you've made an unintelligent decision because it was based on, it was not full disclosure. And therefore you have a cause of action, we call it in Tennessee, lack of informed consent. And that is just as viable as a claim for medical negligence, because basically it is negligence. It's failure to provide proper information.
Can that be written in the paperwork they give you, or are they supposed to verbally tell you?
The good ones do both. They'll make sure it's documented in the paperwork, and they'll talk to you about it. Now, what I'm seeing more now, Nick, is kind of a strange scenario where doctors are delegating that authority
to the nurses,
to the nurses or physician assistants, and they're the ones that are educating the patients. That worries me a little bit. I, as a patient, I want the doctor to tell me these things.
Yeah.
I don't want some junior flunky to come in there and read from a boilerplate list, and then if I have questions, oh well, whatever, you know. I mean, I want the doctor to do it. Unfortunately, I think the law probably lets them get away with that. I just think it's bad practice.
So you can ask, but the doctor may not come in or may not be available or whatever.
I mean, well, they may. Look, a good physician extender would do that. They go get the surgeon and say, you know, Mr. Kelly's got some questions about this procedure he wants you to answer. But I think the physician-patient relationship, Nick, is special.
I agree.
Okay, every bit as special as attorney-client.
Yep.
And because of that relationship, I think it imperils the relationship when you start delegating out, you know, responsibility to other people. I think it cheapens it.
Mm-hmm. But you've told me on more than one occasion it's the nurses that now run the show and have for some time. And there's some very fine nurses.
That's all I want to say about that. But it's you know.
Okay. All right, listen, before we go to the break, I just want you to set it up because we'll go into more detail in our final segment on burns. Why burns? That kind of surprised me when you said that.
Because there's so many ways it can happen.
Burns.
And it burns. Okay. And we'll get into this after the break, but I had a guy who had an IV put into his hand. And as a result of the way it was screwed up, he developed a burn all the way up, almost to his elbow. The solution that was in the IV it's a calcium compound, and it is what's called a vesicant, and that's just a fancy medical word for it is a irritating substance. So when it gets into the tissues, it immediately begins to damage the tissues. And the damage is like a burn. It's not from heat like a flame, but it's the chemical reaction going on in the tissue that acts like
Was he sitting
heat.
there with that IV in there? And he's like, this is burning my hand?
Yeah. Now see, unfortunately it takes the body time to figure out how bad it is because inside the deep tissues there aren't as many nerves as are up top on the epidermis. So it takes a while to begin to really feel the full extent of that pain. But when it kicks in, when it finally does, it hurts like a blowtorch. The problem is by the time you pick it up and realize what's happening, you try to get exactly.
All right, well, should we take a break on that and then we'll come back and go into the detail? Let's do that. We'll take a break and then I want to go into, I've not heard that. That's just nasty. And we had Eddie and a couple others that just fell off. If you want to call back, we can take your calls in the next segment as well, right after this. Stay with us.